Hello, everyone. Welcome to today's IMU live talk. We just give a few more moments for a few more people in the waiting room to come in. So while waiting for them to come in, so I just introduce myself. My name is Dr. Mai. So I'm a senior lecturer of the School of Pharmacy, and I will be your host today. So just a
Hi.
few housekeeping announcements. As you can see on the screen, all participants will be muted. And if you have any questions, do feel free to use the chat box below and then just type in your questions. We will take your questions during the Q&A. So as many of you realize that pharmacist roles has been expanding tremendously for the past decade. It certainly is not what used to be as what I studied as a pharmacist in the past. So on this note, today we are very honored to have our speaker, Dr. Wong Pei Se. She is the Associate Dean of Teaching and Learning of IMU. She is also a Senior Lecturer of School of Pharmacy. So she has more than 18 years of teaching experience in pharmacy education, and she is very passionate in terms of this pharmacy's development. So without further ado, let us welcome Dr. Wong Pei Se. Over to you.
Yeah, thank you, Chitwai. Yeah, I think it's a pleasure today to be able to share with all of you. As Chunwai said, I'm Dr. Wong. I'm currently the senior lecturer in the School of Pharmacy, and I'm also holding the position as the Associate Dean of Teaching Learning for the universities. I think it's a pleasure for me to be able to share with you my perspective of how I think pharmacists could be staying relevant. I'd like to start by just sharing with you a little bit about my journey as a pharmacist or my journey in pharmacy. Okay, I like to start by saying that my first degree was in 1996. I joined a twin pharmacy degree that was offered by IMU. That time it was called IMC, in collaboration with University of Strathclyde, and that was in 1996. It wasn't an easy decision for me, and it took me about 2 years to decide what I wanted to do. I think maybe some of you who are looking for whether pharmacy is a career for you would probably be going through the same thing. I was myself at that time, I wanted to be an accountant. I like maths, but then I sort of figure out I couldn't even distinguish between debit and credit. So that's not really something I can go into. And my dad in construction, on the other way, wanted me to become a quantity surveyor. But my neighbor is actually owned a community pharmacy. So he owned his own private practice. And I went to the pharmacy once in a while, and it struck to me, maybe I should become a pharmacist, a community pharmacy, and I should own one of these pharmacies in future. So that's how I ended up in a pharmacy course. After the in 1998, when I completed my pharmacy, I went into hospital to do my 1-year internship. So then during the period, then I realized I really enjoyed taking care of patients, talking to patients about the medicine use and all that. Then I realized perhaps maybe community pharmacy is not something I really like. So I decided that maybe I should just stay on and work in a hospital. But recognizing that I have a lot of things that I didn't know, so I decided that perhaps I should just go and advance myself. So I went to UK and I did a master in clinical pharmacy, which actually allowed me to advance myself with a little bit more knowledge about how to use medicine and also how to make sure medicine are properly used among patients. So that would be very helpful for me when I come back to work in a hospital. So after completion of my master, then I came back to Malaysia and I went back to the hospital that I used to work to, and I told the chief pharmacist, I like the job in your hospitals. And the chief pharmacist sort of gave me a different opinion and said that I probably should enter academic instead, because at that point in 2001, there are very few pharmacists who actually had a qualification in master of clinical pharmacy, and the Malaysia at that time was actually in demand of growing hospital pharmacists who actually are in need of clinical knowledge. So that's how I ended up considering teaching as a sort of another option for me to think about. But I wasn't so sure, so I entered Guardian part-time. In the meantime, I did some part-time job with IMU, and that's how I discovered again that, oh, okay, actually teaching students is not too bad as well. I enjoy my passion in educating people, sharing with people what medicine about, how to take care or how to make sure the patient are getting the right medicine, how to convince the patient to take their medicine. And you know, that's my passion ultimately. And of course, I think it's good to be able to sort of transfer this type of passion to some other students that could in future become a pharmacist. So hence I took up the offer to become a lecturer. So I stayed on in IMU as an academic teacher since then. I don't think my journey of pharmacy actually really like stopped at the moment that I get a job, like let's say that keep me for 18 years, you know, from 2001 until now, you know, to stay relevant as a pharmacy educator, I need to work hard as well. So I did a PhD to sort of advance myself in research, to give me a little bit more advanced knowledge about how practice should be going. And at the same time, and recent years, I also decided that I will embark my second master, a postgraduate degree in education. So I think current job that I'm doing as a pharmacy educator is not really just teaching. Ultimately, I'm doing a bit of research, I'm doing a bit of management. I think what I wanted to share as well, you know, up to this point is that from my 20 years journey in pharmacy, I think I like to also highlight that there are things that I learned and I like about the pharmacy career. If you listen to my stories, you will realize that pharmacy is a very diversified profession. I practically can use my degree to work in community pharmacy, can work in hospitals. I haven't been into a companies, but there is opportunity a pharmacy can move into companies as well. And the training that I was offered as a pharmacy, not just include drug knowledge, but include a lot of practical skills that allow me to adapt creativity into different settings. So that's one of the advantage that I realized as well. And if one is willing to advance themselves like me, like doing some master or training course, not necessarily postgraduate degree, but advance yourself in terms of knowledge or skills, then you will be having a lot more opportunity to move into other areas, like myself, move into academic. I think there is endless, really never-ending opportunities in patient care, scientific research, and innovation if you like to venture more into it. And of course, job security is there. And then lastly is the job satisfaction. You know, to me, job satisfaction is really important. When I was working in hospitals, I really enjoyed taking care of patients, you know, talking to them and convince them taking their medicine. And as a teacher, I'm really happy to be able to see achievement of my many passionate and competent pharmacists that I've trained. And in fact, you know, the host today, Dr. Mai, all right, was one of my students. And, you know, I'm really proud of his achievements as well. And he's now my colleague.
Yeah, we enjoyed the times that being your students. I still remember in the past, we have the final year attachments in the hospital. You were my preceptor. I think we have quite a good mentor that helped us throughout my journey. Although I'm different path in my career, but certainly Pei Se have actually helped me a lot since the old time. Yeah. Thank you for your time. So that's why I'm also a bit nervous today to host. Imagine your lecturer is talking and I have to be the host today.
Yeah. I mean, I think like what Chun Wai says, I think it's a very interesting, if you are very passionate in it, then you will find the ways where you are. You may not necessarily go in with the right mindset, like, you know, I want to become a community pharmacy and I will end up become a pharmacy. You can always change the path if you want to, you know, just like Chun Wai. You know, I'm not too sure what he intends to do originally, but he's doing very well now as an academic. Yeah. You know, as I shared just now, you know, as a pharmacist, you can work in community pharmacy like Guardian Pharmacy. You can work in hospitals. And of course, the other option is to move into companies. And these companies could be manufacturing, it could be, you know, distribution or sales and things like that. And the job scope can be from research and development, marketing, sales, pharmacovigilance, or even drug information. So, and of course, we also observe that because healthcare demand is increasingly more, and to stay relevant, we also see that there's a growth of like personalized medicine, cosmeceutical, nutraceutical, and veterinary medicine. And these are the areas that also gaining a lot of pharmacies' interest, and a lot of them are venturing into it as well. Okay, other than that, of course, there is job like medical writing or academic, which pharmacists could do if you get suitable training. So there are really plenty of opportunity that you can actually venture into. So, and of course, as I said, if you like to stay relevant to the area, I think to me, I think advancing yourself is one way. So really keep yourself updating with a lot of literatures, evidence, what's going on in the healthcare and what's going on in the sector that you are planning to move in. So pharmacy career is really a career that requires a lot of lifelong learning. Yeah.
Very nice.
Yeah. Okay. I think this is my life slide, really, and I like to just share a little bit how I see about pharmacy staying relevant in the pandemic situation at the moment. We know some pharmacists at the moment are working with other professionals in research and development. So we could see some of them involving themselves in vaccine or drug development. The job could be discovering, developing, or testing drugs, testing use of drugs in patients. Some practicing pharmacists that we know of are also involving themselves in testing of drugs for repurposing. So this refers to drugs which have been licensed for other usage, but if you want to know whether it's working or effective for COVID-19, so you have to do another clinical trial, another testing, and you require some of the pharmacist's effort to help to monitor them as well. And some community pharmacists are also involving in triage and also referral cases. And US at the moment, there's also debate whether pharmacists should be doing a bit more screening of COVID-19 using some rapid testing. So that's still ongoing. In some countries, we know there is actually a shortage of medicine. So pharmacists in manufacturing are also quite busy and getting quite relevant into and helping and making sure that there is a continuous production and supply of medicine to hospitals and pharmacy to meet the healthcare demand. All right, and during the pandemic, bearing in mind, we don't have just thousands more of patients with COVID-19. We also still have many patients who are on medications such as high blood pressure, diabetes, and some of them, really having challenged to get supply due to the MOC, the movement control order. And some of them, even worried to go into hospitals to get their medicine. So they really need supply of medicine. So I know some pharmacists has been working, over weekends to ensure the pharmacists get their supply. And I have to really say that, I'm amazed with how they work, because they work so creatively to get supply to the patient using different path delivery service, to get patients some of this medicine. Yeah, I think, these are some of the amazing jobs that some of the pharmacists are doing. Yeah, for medicine, which is lack of supply, then we also see that some pharmacists will have to work hand in hand with doctors to find substitution for medicine. Ultimately, I think pharmacists never work alone. I think we always work hand in hand with other healthcare professionals. But having the unique knowledge and role and skills, I think there are many positions that we can move into. Like I said, just like in any sectors, and of course, even in pandemic situation. Yeah. So I suppose just what I wanted to sort of sum up with is that I think pharmacy is a very flexible career option. There is never ending opportunities. It requires a little bit of passion and persistency if you want to pursue some new opportunities. And of course, it really requires some creativity and adaptation to stay relevant in the healthcare system or even in any sectors that you move in. Because ultimately, we have to understand change is inevitable. There will be always healthcare need change from time to time. So to be able to survive, or to be able to stay relevant, we do require some of these skills, and of course be open-minded to stay creative and adapt to it all the time.
Yeah, I strongly agree with that. Yeah, because without any change, and we must be stay relevant to the field so that to make our progress in contribution to the society. So thank you, Pei Se, for the very interesting summary. So for the audience, if you have questions, please start typing up in the chat group. So we will first take the first questions from JL. So JL asked about, is there a possibility for foreigners to register and start working in Malaysia as a pharmacist after graduate from IMU? Is there any exam that needed to be taken for foreigners?
As what we know at the moment, the registration pathway or registration in Malaysia is only allowable for Malaysian. All right, so there might be a bit of challenge for non-Malaysian to be able to register in Malaysia at the moment. Yeah, I'm aware that there are situations where case-to-case basis, there is some non-Malaysian that has been registered, partly because I am not too sure. Perhaps the best way to do is really to check with the Pharmacy Board Malaysia of what is the latest regulation on that. But as I said, as I know, it doesn't permit any non-Malaysian for registration at the moment, unless there is special circumstances. So it's really case-to-case basis.
Yeah, I think the summary is JL perhaps need to also see what we can, he need to look through the Lembaga Pharmacy, which is the official Pharmacy Board webpage. They will have a clear guideline on how foreigners should register themselves after that, okay? Now we move on to the second questions. We have a questions from Kang Chin. Whether do we need to study mathematics during the pharmacy course?
Mathematics, yes. There will be some mathematics that you have to go through, because as a pharmacist, we do need to know quite a bit of calculation. Because if you imagine, the simplest one is that when you dispense medicine, you will need to know how to calculate how many tablets to give, what concentration to give. And if you work in a lot of manufacturing, that's even more important, because how much raw material you have to put in to make a medicine, you know, and that's also applicable to a lot of people who are working in research, because concentration of medicine is something quite important for us. So it has to be quite accurate. So in a way, yes, mathematics is one of the components that you need to be able to, that you will learn in the course as well.
Yeah, I think I have to also add on to that. The mathematics is not like what we expect you to be advanced or theoretical mathematics, but it's more on the applications of mathematics. Because at the end of the day, we don't want to kill our patient. And medicines are a kind of poisons, and if you go overdose, could be problematic to the patients. Yeah. So we have another question similar to the curriculum. How should I affirm my interest in pharmacy? This is asked by James Kong, because he has an interest in organic chemistries and biology, especially on how the medicines work.
All right. Okay. I don't really know there's a good way, but how I gauge is that I actually look at 5 years and 10 years down the road. I imagine how I would like my life to be and how I would be. If you remember, I started by saying that how I decided to embark into pharmacy. So I sort of visualized myself, you know, will I be liking to do the jobs that was offered to me? So I had that time, you know, I really like what I see. I think I don't mind doing that. So if you are not too sure, I think the really best way is to talk to someone or to see, you know, to observe by yourself. Like example, go to retail pharmacy and see how they operate. If you ever had chance or that you know of any pharmacist, speak to them. And of course, we are very happy to speak to you as well if you need more information about a pharmacist career. Yeah.
So James, to follow up with us, and we can actually perhaps advise a little bit more. But on the notes of how the medicine works, and organic chemistry is actually one of the major components in pharmacy. Because personally, I'm working on drug discovery, so that is actually a major important role for pharmacists to be involved in. Okay, now moving on to another questions from Wei En. Sorry. The question is, can you share your experience working as community pharmacist? I read on the service providers such as smoking cessation, preparation, oral suspension, or cold chain management. However, due to situations, it's hard for me to get an attachment with community pharmacy. So perhaps more on like, what do you feel like if she's interested, and what's the experience like working as a community pharmacy?
Yeah, I think in community pharmacy, other than serving the customers, you have to be prepared to be willing to join in or do some of the operation. Yeah, so a lot of pharmacists in community pharmacy not only service, basically provide services to patients, like you said, the smoking cessation and even weight management. So some of them offer advice for patients who need to reduce weight or to keep themselves healthy. But a lot of the pharmacists inside are basically involving in operation, like example, purchasing of medicine, okay, making sure that there are enough stocks in the pharmacy to sell to the public or the people that comes in, all right. And of course, there's a lot of operation, other methods, like example, training your staff, keeping inventories, you know. There's a lot of regulation that's applying into community pharmacy setting as well, and a lot of course, the pharmacists will need to ensure that they know about it and be able to maintain that type of recording, and also whatever other services that's accordingly needing by the population or the customer set that they are giving. So we know some pharmacists are even involving in providing services like devices, you know, other types of ambulatory care, things that may be needed by the community. Yeah. So the wide scope, the scope of a community pharmacy could be quite wide, because it really depends on where is your community pharmacy and what types of community that you get. So a lot of time they try to adapt creatively to the population or the community setting as well. And of course, that's important, because community pharmacy, of course, is a portal for you to serve the customers and all that. But at the same time, of course, community pharmacy need to maintain a business, you know, and we understand that fact as well. Yeah.
The same questions that is actually building on to Wei En's questions also on community pharmacy is there a lot of traditional dispensing and compounding currently done by pharmacists, or most of it is already manufactured by someone, so the pharmacists are no longer needed to do compounding? So what is your thought on this?
A lot of pharmacists don't really do compounding anymore, because if you observe, there is really a lot of preparation that we had now is basically sort of GMP certified, like good manufacturing certified. So all the a lot of medicines that the pharmacists are actually dispensing or giving or recommending to the patient are already in the formulation pack form that is already ready for dispensing. So pharmacists don't really do a lot of compounding, but there are some pharmacists who are actually involving themselves into customized compounding. You know, like there are patients that require a very selected concentration of medicine. So there are cases that these types of medicine are being sort of customized into a selected concentration for the patient to use. So this is quite common sometimes among the patient who are having skin problem, or even kids, pediatric, you know. So there will be some pharmacists that could do that. And in fact, actually KL and Penang, we know of a few services that do this type of compounding. Yeah.
And actually pharmacists in Australia have a special route to take they call it a special compounding. So for pharmacists who is interested in going into compounding. So definitely there is a demand in terms of special compounding. So now moving forward to another questions now we have a question from Frankie asking about what's your thought on pharmacists' role for health in IT? So digital era.
Digital era. Yeah. I think I think it's very difficult nowadays to tear about the technology with any setup. Like, you know, whether you work in a community pharmacy, whether you work in a hospitals, whether you work in a company, you will sort of need to know a little bit about digital, you know, the technology of it. Yeah. So, but the extent of how you use the technology could be very different. All right. Of course, if you see Malaysia, I think we use a lot of technologies in supporting prescribing work, which means that for knowledge to get us to get information that's most updated. So that's the most basic things that you will see that pharmacists using all the technology for. But of course, in overseas, you will see a lot of technologies are being used to substitute or to help you in managing some of the work. Example, Japan would have robots to help some of the dispensing work. All right. So I sometimes get the questions, you know, people asking me, so robots are doing what the pharmacists are doing. So do I still need the pharmacist then? I like to probably just share my feeling about it is that we can train the robot to do the repetitive work, which means that work that doesn't require too much of thinking, because the robot may not necessarily know how to, they haven't got into that types of knowledge to be able to create, to think, you know. So a lot of robotic use in like pharmacy is mainly at the moment is at the stage where they could do steps that's given to you, which means the instructions is already been determined. Okay, but ultimately you need someone else to take care of it, you know. But if we look at Japan, they have the robot to take up some of the job, but that allowed the pharmacist to do something else. You know, the pharmacist then can spend more time with the patient, you know, so they don't have to do some of the job that robot can do. Yeah. So, and of course, I do think that we will see technology being embedded to a lot of practice more and more, you know. I'm sure now at this era, at the moment that we are having MCO and pandemic, of course, I also hear that some pharmacists have been giving consultation online as well, you know, so that's another thing that is going to be happening and probably going to be happening more and more. Yeah, and especially, of course, in Malaysia as well. So there will be a lot of potential growth in this, and hence the reason why we also emphasize that I think the pharmacists should be trained in these type of areas, because that's relevant and you have to keep up to that, yeah, with this changing demand as well.
I think that it is also what you have mentioned just now. It really depends on the pharmacist whether they want to take up additional role and skill sets. And of course, technology is advancing, skills is a lot to catch up.
Yeah,
I think
right.
also, I personally know there's a pharmacist who's actually behind writing the code of where to find the mask for us in Malaysia. So it's actually designed by the pharmacist. The whole coding and everything was done by pharmacists. So it really depends on what you want to do and how you want to contribute yourself. So interesting. So now move on to another topics that you highlight in your presentation. So Samantha asked about, can I know more about cosmeceutical?
Cosmeceutical. All right. Cosmeceutical basically is a field that combine cosmetic or basically with therapeutic use, which means that you're using a cosmetic that has a therapeutic use. Example, cream for acne, you know, like cream for acne. So at the same time that you are using it for, of course, cosmetic are usually for appearance use, all right, it also has a therapeutic use. Yeah, so in the past, we only think about developing, example, acne cream as an acne cream. We'll never think about acne cream perhaps can be also a cream that you use. At the same time, it gives you protection on acne, but it also can give you, can make you look better in that sense, you know. So which means that it is a combination field of how you translate certain products that's used for cosmetic reason, but at the same time, it can actually help you in some of the, it has a medication use. Yeah.
So, yeah, wonderful. So I think pharmacists have a very important role in making sure those creams are relevant and important for the patients. Okay, now we move on to another questions about workforce. So what do you think about the current outlook of pharmacists in Malaysia? Is that the numbers of the pharmacists in Malaysia considered to be oversupply? A question by Natalie.
Yeah, I think this is a very popular question usually whenever I have a pharmacy talk. All right, I don't have the exact ratio of what is the status at the moment for pharmacy, but I knew it's probably around 1,000, one pharmacist to about 1,600 to perhaps 1,800. It depends on which numbers are you using. Are you using the pharmacist active one, or are you looking at numbers that actually renew their license every year? So that could be changing at some point. 2 years ago, I knew that the pharmacy board announced that our ideal number would be 1 to 1,200. So by number, it looks like we don't have enough. All right. But I know many people are not convinced with the numbers, you know. But personally, I believe there is still a demand for pharmacists. I mean, I strongly believe in that, partly because healthcare demand is always growing and is increasingly. And we know healthcare needs for healthcare team are actually growing at the same time. And why is that? Partly because we have a growing aging population, and that's actually affecting many different countries. So people live longer. All right, but unfortunately, as people live longer, many of them actually are having also many multiple diseases, and that's not uncommon. You know, you can see that a 60-year-old patient will at least have about 5-6 medicine with them, and along with that, they have disability, so they need medicine. All right. At the same time, because of that, there is a growing healthcare facilities and services. And because people want to know more, people are different now. You know, people are getting more and more educated. They like their service to be done differently. They no longer just keep quiet and, you know, wait for you to serve the medicine. They are demanding more. Hence the reason why you have individual care, you have personalized medicine, because they are demand and they are change of demand. And that's the reason why, you know, you will need pharmacists along with other healthcare professionals to actually cater this type of demand for the public. And the other sector that's actually growing as well, you know, as I said, people are growing older, but not necessarily all the time they get more and more diseases. We also want them to prevent these diseases. So there is a lot of need as well to educate people, to make people healthy and all that. So that's the preventative care, like example, weight management services. So I know of some of my my students or who are actually doing masters, and she's actually into this type of weight management, coaching and all that. So that's another areas that I think pharmacists can always explore in. So like I said, I truly believe, I think there will be demand, but it's just that whether these are the types of range of jobs that you would like to do, I think that's something that you have to consider. Because if it's your passion and it's something that you like to do, and you will do better and you will find ways to do it. So I don't think there will be a concern into that.
Yeah, I agree. I think it really depends on how you want to chart your path and things like that. I don't think the path that I'm walking now is also the typical way of pharmacists is doing. So I think that's what a lot of people was telling me. It's not the typical, the one that we learned during our classroom. So definitely the oversupply questions is just overrated. So, okay.
Right. Yeah.
Now we move on to another question from Shafiq. So I'm not sure whether I get this question correctly, so I will just read it verbatimly. Do pharmacists in Malaysia got a good amount of validation compared to other countries like UK? I'm not too sure, Shafiq, what you refer to validation. Perhaps does it means recognitions or by from the publics, I presume? Perhaps, Pei Se, you can take the questions as would pharmacists receive enough recognitions from the public?
I mean, okay, if I take the questions as what I could understand, basically you're asking whether our IMU BPharm program would have been able to be accredited or being recognized overseas. Okay, if I take it that way, basically I think the 4 years BPharm program that's done fully local in Malaysia, at the moment is only registrable in Malaysia, because we undergo the Malaysia accreditation. And hence, we know if you're Malaysian and you fulfill all the requirements, you will be, and fulfill the internship and all that, you will be able to go for registration. And of course, if you are saying a country like Singapore, Australia, UK, at the moment, our BPharm program would not be able to get you a direct registration. But if you're very keen to work overseas, so there are options. I know of we know that from some successful cases, we have a few graduates of our BPharm program that have managed to register themselves in Australia and UK. So what I know, what they have done is that they have completed their internship in Malaysia, and they have got themselves as a Malaysian registered pharmacist. And they apply to Australia and UK as registered pharmacists overseas. So they take the path as to how overseas registered pharmacists should apply or should do to get themselves registered in UK and Australia. So subjected to the requirement of that particular country, they managed to fulfill the requirement and they were successful. Okay. And of course, the other option that I like to suggest that perhaps a bit easier for you is that if you like to consider registration overseas, you could explore our credit transfer options. We have credit transfers options to Australia and New Zealand, and that credit transfers option can allow you to register over in Australia. of course, there will be requirement that you need to fulfill at Australia or New Zealand as well. So I hope that is what that helps him in the answer.
Yes, I think he clarified in the text that that's the questions that he wants to ask.
Yeah,
so
I hope it helps. Yeah.
Yes, I'm sure we have actually a lot of friends actually. They go through the registrations process in every different country all by themselves, and they have successfully get a job in like UK and so on. So I think the chances is there. It's just that you have to pursue the path. It's not impossible. Okay. So now we move on to the next questions. This is a bit about clinical training. So Shafan asked about, hi, Dr. Wong, in conjunction with current pandemic of COVID-19, almost all School of Pharmacy will replace their undergraduate pharmacy student clinical attachments at hospital under KKM to simulated clinical cases or simulated based practice. Unfortunately, it should be emphasized that it is a supplementary experience and not a total replacement for clinical experience. So what do you think about what is the best method for the time being?
I mean, I do not know how to say whether it's fortunate, unfortunate. We don't have any students who are needing to go placement at this time. Our students probably will be needing to go placement sometime around year end. But of course, this conversation has started already. There are similar concerns because, I mean, I do agree. I don't think it will be able to fully substitute the purpose of a placement, because if we are talking about clinical placement, we are really talking about what we call workplace learning, which means that you are learning based on a workplace, you know, and it's a very important component in pharmacy training, which I believe has to happen. But unfortunately, during this pandemic and of course situation, it might be very, very difficult. So of course, all universities are trying their best. The case method, the case-based learning methods are one of the good methods, and it has been proven to be able to help students in improving critical skills, communication skills at some point, and of course problem-solving skills and all that, depending on what type of cases and how do you implement it. So I won't object to that. I think it will help, but it might not fully substitute the learning outcome, if the learning outcome is really wanting the person to understand the setup in that sense. I mean, of course, from universities, and universities, it depends on how they've arranged it. I'm sure many universities would have considered, if the placement is really an essential component, they might have to basically move it later to a safer time to be done. All right, I think that would be the better options. So at the meantime, of course, all universities will try their best to maintain certain types of learning so that you don't completely stop, you know, so that you're still able to build to certain things. All right, because placement is not just decided by the universities. A lot of our placement in pharmacy actually goes into the community pharmacy, private hospitals and hospitals. So it also depends whether they are actually ready to accept students or not. Because we have to understand at this situation, the teaching learning is not the most essential thing going on for them. For them, I think the essential thing is to keep the patient safe, to keep it what's most logical for their healthcare setup. So we fully understand the struggle. Yeah.
If I recall, remember last time when I have the attachment with you, I remember going to the setup is just one thing. You can have all the case club, but the most important is the discussions with the preceptors and the facilitators about how to go about the case. I think I personally learned a lot from the discussions rather than being in the setup, because I think if you really want to brush up your clinical knowledge, there's still a lot of other ways to do. You can have a more rigorous discussions with the preceptors, the online learnings, and a lot of these active forums is also there for you to brush up. And I'm sure the learning have no boundaries nowadays.
Yeah.
It shouldn't be confined to one classroom or one space. I think that's what our philosophy, I think, is also what we are trying to build for our students.
Yeah. I mean, I agree, Chunwai. I think what you mentioned is very true. So it's really back to what does the education or the schools or the curriculum wanting to meet ultimately. Yeah, so there are certain things that could be done, you know. Yeah.
Yeah, anyway, placement is never to just throw you to the setup. There is a lot of actually discussions that is actually make it better.
Yeah.
Okay. Now we move on to the next questions from Puiman. So Puiman wants to know what's the difference between pharmacy and pharmaceutical chemistry?
Yeah. I think Chun Wai probably will be able to explain a little bit as well, but I will start by sharing a little bit what I think about it. I think in terms of curriculum, differences is that as a pharmacy chemistry, you learn a lot about being a chemist. All right, so you learn a lot of how drugs are being, the chemical sides of drugs, example, discovery, how the chemical changes would change the medicine property. So a lot more laboratory related or research related oriented. And of course, some of them may go into formulation of medicine. Yeah. But for pharmacists, I think we learn part of that. We also learn about patient care. All right, so there's a big chunks that we deal with that in pharmacy curriculum that you will learn about body, because for you to be able to talk about medicine, you need to know how disease happen, how disease change your body physiological, how the medicine helps in recovering, improving some of the condition that you're having. And of course, we need to know about the property of the medicine itself. So with that combination, you get what we call the pharmacy. And from that pharmacy, and of course, pharmacist, another way for you to look at it is a accredited profession, which means that beside getting the degree, you need a proper certification. With that certification or licensing, then you can practice, formally as a pharmacist per se, and that's the slight differences. So I think in terms of job scope, there are some jobs that you will be able to find pharmacists and chemists will be able to do a lot more, like research development, perhaps some of the company job, like corporate types of job, is not a problem. But if you are looking at a community pharmacy hospital setup which require patient care, then you will be needing a pharmacy degree and of course a proper license to be able to practice inside the setup itself. Yeah. So perhaps Shunai can share a little bit about what he thinks.
Yeah, I think Pei Se rightly pointed out that as a pharmacist, you are bound to the registrations, that the code of conduct that you need to follow, because of your advice and your counselings will actually affect a person's drug regimens and things like that. So pharmacists mainly play a role in terms of the rationale of drug use. So what is the best medication for these patients according to the condition? So like cough and flus and things like that. But pharmaceutical chemists, they are specialized in terms of understanding the components inside the drugs. Like personally, I work with pharmaceutical chemists. They are the synthetic expert. They are the pharmaceutical analysis expert. So they analyze the content of the drugs or mixtures, and they tell me that what's inside there. Then I will decide the next what are the combinations to go about it. So we work hand in hand with each other. We don't replace each other's role, and each other have the important role to play, even in the industry setup or even in research and development. So, okay, now we have about like less than 15 minutes. So unfortunately, I think some of the questions we may not be able to finish. I think the participants are more eager than what we anticipated. But we will try to take as many questions as we can. So now we move on to the next. What are the future prospects of pharmacists? What do you think? The question from Chan.
The future prospect, I think, like I said, I think there are many opportunities. But ultimately, it depends on what a person wanted to do. I think I take my examples as an academic with a pharmacy background. I think my perspective would be very different, perhaps very different from what Chun Wai's, who is also academic, but he's more into research as well. So that's another different perspective. But in terms of, as I said, because the healthcare needs are growing and there are more and more demand, definitely you would need more pharmacists together with all the healthcare professionals to take care of all these patients. And that's why I feel that there would be a lot more opportunities that pharmacists can go into. But again, this opportunity is really endless, because there are many areas that wasn't there when I first started as pharmacist. Like example, personalized medicine, it wasn't there. I have never even heard of nutraceutical. I've never even heard of cosmeceutical. you know, as when I was joining as a pharmacist, but now it's gaining more and more interest. And the other thing that we don't mention quite a lot is the data science. All right, there's quite a lot of interest into healthcare analytics now, using a lot of data in helping decision makings, whether it's healthcare, drug use, drug discoveries or developments and all that. Yeah.
Yeah, I fully agree with you that there's no limit to that actually. There's a lot of new opportunity coming up, as we mentioned just now. There are pharmacists or even involved in coding and coming up with new apps and things like that. So definitely there are lots to discuss and lots to watch out from this space. So moving forward, there is another question that talking about postgraduate. So Celine asked about after graduating from IMU, if want to consider a master program, if I'm interested in drug development, what would be your suggestion?
I mean, of course, there are different ways to look at drug development, as I know. You know, if you're looking at molecular level, I know we have a master's program as molecular medicine. So that's a little bit related to that as well. But of course, I knew some actually are offering like masters in pharmacology. So that's another areas as well. I think there might be slight differences with it. So I think my recommendation is that you get maybe someone like Chun Wai, you know, Dr. Mai here can help you as well to follow up on what exactly is your interest in this drug discovery. Perhaps find the area that what exactly that you are interested in, and then we can suggest which are the better path for you to take. Because although there are generally a lot of drug development areas, you know, even chemistry is one of the part that you can lead into drug discovery, you know. So I think the area is just too wide at some point. So you need to really pin down or having a little bit clarity to what do you want to do. Yeah.
Yeah. So I think in short, if I remember, in IMU itself, we have actually quite a lot of master program also related to drug development. We have Masters of Analytical and Pharmaceutical Chemistry, which is also very specific to in terms of drug design, drug analysis in terms of content. Like Pei Se mentioned, we have the Master in Molecular Medicines, which is looking at the genomics and pharmacologies and drug target for a disease or to design something diagnostic related. Alternative, in addition, we also have another one is Master by Research or PhD by Research. So you will be supervised by a professors or a senior researchers on a particular topics. So if your professors is in cancer research and things like that, so the likely drug targets they're looking at is also cancer related. So for master or PhD by research, that one will be really depends on your research interest, what kind of drug that you're trying to develop, and that's how we pair with the respective supervisors. So these are a few options that you can consider, and perhaps we can move on to the next questions. Okay. So there is questions also asking about why choose pharmacy in IMU? What would you think?
Okay. I think I should point out that I am an alumni of IMU, so which means I did my first degree even with IMU, and Chun Wai as well. So both of us actually, you know, are basically practically IMU product. I think I will speak for myself why I picked IMU at that time, and obviously the reason is because IMU was the first private pharmacy school in 1996. There's no other private schools. So I think if I put that straight to you, basically, which means that from 1996 until now, IMU have 24 years of experience in teaching pharmacy, and we train over 3,000 graduates. And I'm very proud that I helped to train maybe half of them, you know, at some point. Yeah. So, and the university itself is quite established, a private universities as well. And of course, the other thing that I also feel that I would strongly recommend students who would like to embark into healthcare to consider IMU is because IMU is like a network of healthcare professionals. We are very central and focused on healthcare. most of the profession or most of the degree that we are offering are actually very healthcare focused. So we are expecting, of course, to provide all the students an environment where allow you to know many other healthcare professionals. And just bear in mind, a lot of our students grow up with doctors, they go out with dietitians and all that. So this friendship perhaps will grow as the foundation for you to work with other people at the same time. So I think there is advantage sometimes to embark yourself into sort of a healthcare focused universities from the starts, you know. So that's one thing that we offer. And the other thing about IMU is that, I mean, as pharmacy educators, I would have to say we are very, we try to stay relevant to education, like pharmacy education. I think how do we stay relevant in pharmacy education? I think there are a few things that we do. We stay focused in terms of our industry engagement, because we know our students in future will have to work in companies, community pharmacy, hospitals. So we always talk to and we always engage our stakeholders in all these different workplace or different types of organization, so that we know what are the things that we can improve in terms of our teaching learning. And the other thing is that we engage a lot of our practicing pharmacists, like example, people work in hospital and community, into our skill-based teaching. So that helps to bring in some of the real life experience into the education. And of course, the other advantage that IMU has is that because we have many overseas partners, and of course, we have 2 credit transfer partners as well for pharmacy, but at the same time, we have access to many other information about education in medical and health professional education. So that helps us to sort of keep ourselves updated with what globally, you know, in terms of education are moving as well. So I think that's the few things that I mean, at some point as educator, I think that's one thing I like about IMU as well. So we get the opportunity to always modify and be innovative and creative in our education as well.
I think I come from the era where there's a lot of competitors that offer pharmacy degrees, and the reasons where I pick up these institutes in IMUs, I think is probably a little bit different from what Pei Se have mentioned, but it's pretty much the same, that you have to look at what is the curriculums that is being offered and what is the reputations of the institute. I also been asked about these questions in the past. So as an independent person, I think for someone who want to consider where you want to study, perhaps you may want to do a bit of the homework, not just listen to what other people are just saying, and you just dig up a bit on how's the reputations of the university. Would the university collapse halfway through when the course is running? That's very important, because ultimately at the end you want your degree, and it has to be recognized by the respective body. That's very important, because I help the pharmacy society in the past. We do have some graduates coming from university that cannot get recognitions, and they actually have a problem with that. So that's actually very important. Of course, the second part that is the training. So we mentioned a lot about the curriculums and educations. I think that is very important, because that will mold a potential pharmacist to be, and how you're going to face the workforce in the future. Okay. So we have one more questions, actually talking about expanding role of pharmacists into commercials and consultancy industry. What would be your view on this?
We as educators, because we have some of our colleagues who are into research, so I know that they're actually doing a lot of consultancy to some of the companies as well. So that's on the formulation. So basically on improving formulation. Example, certain tablets are not working very well and not dissolving very well, so it doesn't reach the target that you want. So you get some advice from expert areas to actually do consultancy. So I think pharmacists as a consultancy is very depending on what area that you're doing. All right. So of course, in terms of the pharmaceutical development and research research and development, I think there is a great potential into consultancy. But of course, for one to be able to work out as a consultant, you have to be able to have that expertise in it in the first place. So you must get yourself, advance yourself, really knowing how to consult the particular knowledge that people wanting for.
Mm. Yeah, I think that it's actually very important to make sure that you stay relevant to the industry, because if you want to do a successful consultancies, you have to offer the right advice, and it has to be practical to the industry. Otherwise, they a lot of times will take you as yours is just a textbook answers. It's not really helping as a practical sense and things like that. So I think that that's also makes pharmacies a bit unique, because our training is very holistic and overall, and we take into consideration of all the angles, and that's why it makes us a little bit different from the normal salespersons who do a consultancies to you. Okay, we have another questions coming into. Okay, are we allowed to do internship in a private company? How to go about it? So it's about an internship question.
Okay, the internship, you at the moment, the policy is that you can do your internship in any of the accredited centers. So which means that as long as the particular centers are being accredited by the pharmacy board as a pupillage training center, then you can actually apply to do a job, to do your internship there if they allow you to do. So that include private medical centers. So for you to be able to check the information is actually published in the pharmacy board website. So if you just go into pharmacy website, or you just Google accredited accredited institution for PRP, pupillage training, then you will be able to actually find it. And for you to go through the process, there are different ways for you to go through it. Of course, what I meant is that there are different steps for you to take through. Usually, I think at the point of the graduation, the universities will provide you some information on how to do it. I have to say partly because I can't tell you exactly, partly because there are some changes from time to time. Yeah, so and we will need to make sure that the change are actually in line with that, with the pharmacy board, how they want the registration to happen or the application to happen. So usually what we will do is that, I mean, from our side, usually universities, we will get someone from the pharmacy board to come over to tell our students how to how to apply for the position.
I think that is more to do with the provisional registered pharmacist, which is the PRP training year. And certainly, yes, private company is one of those, and they are accredited center. So private community pharmacy, private hospital, even the private industry. And it's also the same that I think the question is also referred to internship. That means do we send students to this private company? So I think basically we want to add on to that.
Oh, okay. So if you're referring to like placement, at the moment, we do have options for students to do their elective if they want to in the private companies. So we have quite strong connection at the moment with Pantai. So at some occasion, if the student would like to, so we will recommend them to go into Pantai hospitals for a placement. But of course, at the same time, if the students have other interests to go to other private hospitals, we will actually help them with the supporting letters or whatever necessaries. So we are quite open to help our students to get the additional placement if they want to.
So yeah, as what Pei Se says, we have quite successful in getting our students being trained in the respective private company. Okay, I think we are coming to the end. Unfortunately, we still have a lot of unanswered questions. Don't worry, we will actually get back to you via the website. So especially those questions that we couldn't have time to go through, do stay in touch with our webpage. So lastly, thank you for everyone for staying until the end of these sessions. You guys have been very wonderful. The questions are very good, and that makes my life very easy as a host, and hope you have a wonderful sessions. And lastly, this talk is not possible without all the support from our IMU, and also we have the corporate communication. We have a lot of people working behind the scenes, the ITs, and also our support teams in the marketing. And if I noticed there's quite a lot of questions actually asking about pharmaceutical chemistry. And the good thing is tomorrow we still have another session at 2 o'clock. So you do stay tuned to our Facebook. If you haven't registered, So go to our Facebook, register for another sessions to do with what is the role of the pharmaceutical chemist in, especially in this now pandemic situations. The talk is actually will be given by Dr. Lee Choi Sin. She is a head of the pharmaceutical chemistry department of School of Pharmacy, and she have a lot of experience in terms of pharmaceutical chemistry development and the program. So make sure, for those of you who are interested to know, do stay tuned for tomorrow's session, and you will get most of your questions answered as well at there. So see you all in the next time, and you may actually sign up from the Zoom now. Thank you.
Thank you. Bye-bye.